My passion for cardiology developed as a student, and I watched a cardiologist perform a procedure, and I was just spellbound how he could do it through the groin with a little needle and get these fantastic images, and I was just totally blown away, and I thought I'd love to do this.
Beautiful. What do you feel that you can offer your patients as a cardiologist?
If I can help my patients to live a complete life, free of pain, less breathless, and enjoying all the good things about life, I think I've achieved my endpoint. So my main aim is to try and help my patient with their symptoms, pain, shorter breath, and improve their ability to do things.
Okay. Shortness of breath is the next one. And what causes shortness of breath?
Shortness of breath can be due to lots of things. From the heart point of view, it can be related to lack of blood flow, as we see in people with angina, or it can be related to a weak heart in people who've got an enlarged heart, and sometimes it can be due to leaky valves, which are causing the problems. If it's not cardiac, it may be pulmonary, especially if someone's been a smoker for many years and he's developed emphysema or chronic bronchitis. And finally, in people who've had rapid weight gain and have been very inactive, it may be just a reflection of their fitness, that they're breathless.
Okay. Treatment options?
From the heart point of view, if someone has angina and lack of blood flow to the heart muscle, we can improve this by using procedures such as stents, where they open up the arteries, or sometimes with medication and surgery. From an enlarged heart point of view, we would use medication to try and strengthen the heart, and if someone's got a leaky valve, we would monitor this, and if it became severe, we would then consider them for a valve replacement.
Okay, we'll just pick it up. We'll do it again.
Okay.
Treatment options?
For people with shortness of breath, if they have a cardiac cause for it, specifically if they have angina, we would consider them for a stent procedure to try and open up the artery. Alternative for this would be to use surgery or medication. If they have an enlarged heart, we often rely on medication to try and strengthen the heart. And if people have leaky valves, we monitor them until they become severe, and usually the therapy for that would be a replacement valve. In those patients who have non-cardiac problems, we would try and monitor their lungs and try and improve the lung capacity with inhalers. And in those people who are unfit, we would try and give them some lifestyle advice about losing weight and exercise programs to try and improve their symptoms.
Excellent. Okay, post-treatment and surveillance.
After a patient's been treated, we'd like to keep seeing them on a regular basis to try and maintain their lifestyle advice, make sure that they're taking their medication, make sure their blood pressure and cholesterol are all under control. And specifically, we would like to monitor the heart with a serial test, such as an ultrasound or a stress test, to make sure that the therapy is working and hasn't recurred. That didn't sound right.
Okay, let's go back to specifically.
And specifically, to make sure that there's no recurrence of their disease and that the therapy we've already performed is still working.
Call to action?
Any patient who's developed recent onset shortness of breath should go and see his GP to make sure that they're not suffering from any cardiac or pulmonary disease.